inhibits the lower motor neuron. The upper motor neuron kind of keeps it in check. Okay? So if you have a loss of that inhibitory effect, then you're going to have things like fibrillations and fasciculations. And then you're not going, the reflex is not going to work, right? Because you can hit the muscle tendon, it's going to have the sensory going up, but it's going and there's nothing going back down to it, so you're not going to have a reflex. You have decreased reflexes or diminished. And then it can affect individual muscles. And then you're not going to have the ankle clones. Okay, so we'll take a break and then we'll go over pathological reflexes. The upper motor neuron inhibits the lower motor neuron. So if you have an upper motor neuron lesion, you're going to have more excitatory lower motor neurons. So if you force the wrist into dorsiflexion like this, it's going to trigger a muscle spasm. So basically with upper motor neuron problems, the lower motor neuron are already just jittery, right? They're ready to go out of the box. So you do something to stimulate that muscle, you dorsiflex the ankle, it's going to start twitching and going into spasm. And same thing with at the wrist. And then
the reflexes are very pronounced.
The reflexes are going to be increased. Remember, hyperreflexes. So anything that that's not going to inhibit that lower motor neuron is going to get out of control. And then we talked about the difference between conscious proprioception and unconscious proprioception. Conscious proprioception is something like if you're in the Olympics and you're on the balance beam, you need to know what position your joints are in and your body's in, like that.
But why?
I don't know. So that you don't fall and break your neck, right? But it's conscious things like if you need to know where your body is in space. And then it's things like this where you can touch and know where things are. But unconscious proprioception is not, you're not thinking about the fact that when you walk down the street that you have to, certain muscles have to contract, certain muscles have to be inhibited, you have to balance yourself and you have to have your posture. So it's more unconscious things that go on behind the scenes. Because it's just a matter of going like this. Sure, you're going to voluntarily contract your biceps, but you also have to inhibit your triceps and things like that. So it's muscles working in coordination together. Which is unconscious proprioception.
Would it be kind of like learning how to ski, and then like once you become
Yeah,
proficient, then the skiing becomes sort of a tacit action?
Not so much that. I would think of it more in terms of there's a lot of things that you have to learn how to do to ski. And yeah, maybe in the beginning you have to think about all of them. And you have to say, all right, I need to do my snowplow turns and I need to do this. And you're thinking about it. But all the unconscious things, once you learn how to do it, then you're
that's what I mean.
shushing
Yeah,
down the
that's
hill.
what I mean. Like to learn is more like that first part, and then when you're actually
Kind of, yeah. But even when you're learning it, there's still unconscious things that are happening. But that's kind of the way to explain it.
easy about it.
Okay, pathologic reflexes. Okay, these are specific types of things. It's not like a DTR, like a deep tendon reflex. We're going to tap on this tendon and then the muscle's going to contract, right? These are pathologic types of things. Okay? And so this is how I got away with not having that I could wear shorts and sandals today so that I can demonstrate pathologic reflex.
You can wear the
Besides that, I wasn't sure that the AC was going to work. So what you're doing is you're running something up along the outside of the foot. And I didn't wash my feet because they'll be dirty. So we're going up across like that. What you're looking for is this. Okay, the big toe is going to dorsiflex, and the other toes are going to splay out like that. I can't raise it up high enough, and you can see it right there, right? So you're going to go, like usually the pointed end of your reflex hammer, although nowadays the other ones don't have a point, but you run it along the lateral aspect of the dorsum of the foot, or the plantar aspect of the foot, and then you come across, and so that big toe is going to dorsiflex, and the other toes are going to splay out like that. All right? Take the other one. All right, so that's Babinski. Okay, it's abnormal in adults, but it can be a normal thing that you can find in kids. So it's an indication of the corticospinal tract. So corticospinal meaning descending. So up to 6 months it can be normal in infants. So a positive one or present Babinski's reflex is going to be extension of the great toe, which is also considered dorsiflexion, and then the toes are going to spread out. So in general, when we talk about pathological reflexes, they're hyperreflexes, so things that aren't normally seen. Right? So we don't talk about it being positive or negative, you just say that it's present or absent. So the normal finding for Babinski is to be absent. So if you have a report, you're going to say Babinski's was present. And then Filippo Weil. This picture is not for this one, okay? So it's going to be with the fingers, okay? So you're going to flex the forefingers, and then the doctor's going to extend the flexed fingers. And then what you're looking for is flexion and adduction of the thumb. So the patient's going to flex, and then the examiner's going to do this, and then you're going to look for a movement of the thumb. So you're going to flexion and adduction. And then, let's see. No, it's a little bit different. You're talking about this Hoffman one? No, I don't have a picture from this one. I'll see maybe if we can find, like, sometimes I might be able to try to find something on the internet or somewhere, maybe it'll show a video or something. Because I got a video of ankle clonus I can show you as soon as I close up the PowerPoint. And then Chadic reflex is you're going to stroke around or behind.
I have a quick question. What does it indicate if that's present? What are we still dealing with the corticospinal tract?
I think so. We're looking at
Okay.
other remote lesions, but I'll have to look into that to find out.
Okay.
I didn't realize that this doesn't give specific indications for them, but I think we're doing. At this point, just understand that if it's present, it's pathologic. Okay? As far as to interpret it, I'll have to see if I can find that out. I think it's some type of a upper motor neuron problem. I'll have to find out. So Chadic's, you're stroking around and behind the lateral malleolus like this here, like you can see right there. And then you're going to extend the big toe. And then with Oppenheim's, you're stroking downward on the medial tibial surface. And again, most of the time you're using this on the flat handle end of the reflex hammer. And you're looking for, again, extension of the big toe. And then this other one on the bottom here, there's the ankle clonus. Again, so you're dorsiflexing the foot and releasing it. And then you're looking for an abnormal response like that. I'm going to go ahead and play this other one. So you can see how right there it's just. I think it'll play again. So you do something to stimulate it, and then it just goes into that fluttering.